Hi, this is Dr. Paul Goldberg of the Goldberg Tenor Clinic, located in Tyrone, Georgia, right outside of Atlanta. Today, you're going to be seeing an interview with Dr. David Tenor and Dimitra Bornius. Dimitra came to the clinic complaining of so-called fibromyalgia, chronic fatigue syndrome, along with migraine headaches and some gastrointestinal disturbances. I'm happy to say that under our care, largely through Dr. Tenor, that Dimitra is doing far better, as she'll report in this interview. One of the important things that we've seen over the years, and one of the things that really frustrates patients quite a bit, is when they've come into us, they've been labeled usually by a medical physician, with what I call garbage can diagnoses. This would include things such as fibromyalgia, chronic fatigue syndrome, and irritable bowel syndrome. Patients have real issues. These are real problems. The problem is, however, that when we use these garbage can diagnoses, we're not really identifying what the cause of the patient's problems are. And when we don't identify the causes, we're not going to end up finding the proper solutions. At the Goldberg Tenor Clinic, we have long held it's important to, first of all, identify the causes of a person's problems, to address those problems specifically, and then recreate the entire body so that the patient could have good health. I wrote a pamphlet called Fibromyalgia, another name for impaired health, about 25 years ago, and where I explained that these garbage can diagnoses lead to a lot of frustration for patients who are actually sick. But the important thing is, again, to identify the causes, address those causes, and bring the patients back to health. Please watch this interview with Dr. David Tenor.
Hi, this is Dr. David Tenor. We're here at the Goldberg Tenor Clinic, where we specialize in the reversal of chronic health issues. And today I'm delighted to be joined by Dimitra Bornius, and she's doing fantastic. We started working with her back in April of 2021. It's now the end of July in 2022. Dimitra's going to share her story with us and all the wonderful improvements she has achieved. So, Dimitra, I'm going to turn it over to you. Tell us a little bit about the problems you had when you came in and how you wanted us to help.
My main issue was chronic fatigue, aches and pains, brain fog, digestive issues, migraine headaches.
Okay, so yeah, quite a long list of different health issues. And when Dimitra came in, explained to her that these problems were likely interrelated. There were likely some common origins there that we needed to address. Prior to coming in, Dimitra had seen a number of different doctors. And so, Dimitra, tell us a little bit about that experience and what type of treatments you have been receiving and what the outcome of that was.
I've been to a family doctor, rheumatologist, yes. They prescribed me medications and told me basically I had fibromyalgia, and just to take the pain medication they gave me, and that was it. But it didn't really cure the problem. It just masked it.
Okay, so yeah, after all that, the final word was that you had fibromyalgia, which is a diagnosis is commonly given to patients when the doctors, as we were talking about, don't know what's wrong with you. It's a diagnosis of exclusion. It's not this, it's not this, it's not that. So no, you have fibromyalgia, which really doesn't mean a whole lot. Basically means the patient's just got a lot of pain in their muscles, and usually boils down to here, take some pain pills, and that's the end of it. And that wasn't a good solution for you. So we're delighted and we're very glad that Dimitra had come in to see us, as we of course took a very different approach. We wanted to get down to the sources of her problems, and we did that through a detailed evaluation. We did a thorough case history, a physical exam, and got some pertinent laboratory testing, and started her on a program to rebuild her health as opposed to treating her disease and her symptoms. And now Dimitra is doing very, very well. So Dimitra, tell us what has changed for you since you came in. How are you doing now?
I'm doing a lot better. My energy level's up.
You're able to work out now?
I'm able to work out now, yes. I'm not fatigued. I can make it through the whole day without having to take several naps.
Mm-hmm.
I basically, my digestion's gotten better. I can eat what I want. I don't have aches and pains. I don't have migraine headaches. Gosh, the list goes on.
Mm-hmm. Yeah, virtually everything she came in for is doing much better now. You're no longer taking any migraine medication.
I'm not taking any medication.
No drugs.
No,
And
nothing.
she's a history of being on migraine medication frequently for migraines that were occurring 1 to 2 times a week, not having them anymore at all anymore. And her medical physicians had also given her Adderall and Vyvanse, which are stimulants, for quite a long period of time. And that was really running her down. It's very hard on the glands when people take that. You're off all that too now.
Yeah.
And your energy's great. You're able to work out.
Yes.
Wonderful.
No brain fog, focused.
Now, a lot of this stems from getting Demetra's digestive function working a lot better and evaluating her. And we identified that Demetra had a pretty significant case of SIBO, which is a bacterial overgrowth in the small intestine, which also results in toxicity. We redid that test. It's a thing of beauty now. It looks excellent. It's about 90% improved. Her digestion is much smoother, and of course that then translates to better energy, less aches and pains, no migraine headaches. Also, as part of working with her, her cholesterol level, which was high initially, right, it was at 262. Now today, as a blood work a couple months ago, is now 162. Very healthy reading. Her standard blood work is normal. Her blood count, blood chemistry, C-reactive protein, a measure of inflammation, is entirely normal. Not just normal, but healthy. Her blood sugar is well balanced. And she's now the picture of health, and she looks and feels great. So, Demetra, thank you for sharing your story. Is there anything else you'd like to add?
Just want to say thank you for helping me on this journey.